Recently, we came out with a new product called Enamelast, and I was on the team that helped in the development of this product. And I'm finding that Enamelast is probably one of the best win-win products for both patients as well as the clinician. Recently, the AAPD, the American Academy of Pediatric Dentistry, came out with the recommendation that clinicians try and see patients within 6 months of that first tooth erupting. So that's a 1-year-old. As hard as that was for me to even imagine, I was able to do it, and I'm finding that I'm actually able to apply the Enamelast varnish to the teeth of these littlest patients quite easily. Even though they're fighting us, I'm right there with the syringe and able to apply the varnish directly to the teeth. The varnish itself, in all of our research, both in clinics as well as in the lab, has shown that it stays on the teeth 24 to 48 hours. If the varnish is put directly on the occlusal surfaces or gets interproximally, we're seeing it even past the 48-hour mark. It's a great product too that adults seem to appreciate. One, just because of the aesthetic appearance of it. Afterwards, they don't look like they've been eating Wonder Bread. And the other nice thing about it is it doesn't have that gritty feel that's just going to drive them nuts all day. One of the things I love about the syringe is if I get a patient in and I know that I'm not going to be using very much, I can just merely squeeze out the amount onto my glove or onto a surface and use it with a brush. And there's a lot less waste, which the doctors always appreciate. The other thing is if I do want to just be directly in the mouth and not going back and forth between the unit dose well and the brush, say in a case of one of these little 1-year-olds or one of these littler patients, I'm right there with the syringe and able to be up close, stay right with them as they're moving their heads, and able to get the varnish on quite easily. The nice thing about this product and the way Ultradent has developed it is we've tried to make it so that it fits whatever a doctor or a hygienist's need is. They can either use the syringe or they can use the unit dose, whatever they're used to, whatever they're most comfortable with. It's a great product. I'm finding that my patients love it, and I know I love it too.